Hey, it's Dr. Todd Molsky with Freedom Health Centers, and again, this month we're talking about pain and inflammation. And you know, there are many ways to reduce pain and inflammation. And like we talked about last week, and if you haven't seen that video, definitely go back and watch it, is to get to the root cause, right? That's what we really need to do. You know, however, we are pretty, I call it a microwave society, right? We want things done fast, fast, fast. You know, hey doc, get rid of my pain. You know, I want that text to me yesterday. That's basically how it works around here. It's pretty funny. But, you know, we really want to help you to get rid of these things that are going on as fast as possible. And so when I took my basic pure chiropractic office and integrated it with some medical and some physical therapy, now we start to be able to get more things done with you. And some of the medical aspects can actually help you to reduce that pain and inflammation even quicker. What we do are two main forms of injections. Now some people will go, oh, injection, no needle, all that stuff. Well, really, these things are pretty much less than a mosquito bite in how they feel, okay? She's gonna use, Lynn, who's our nurse practitioner, she uses some cold spray, so you know, you feel the cold spray and then you barely even feel the needle. So I do them myself. I'm a chiropractor. I think those things are great, and they really help us to get through the things that are going on much faster. So the two types of injections are what are called trigger point injections, and the other is called a large joint injection. Trigger point injections are basically to help work on the trigger point that's going on in the muscle. Trigger points are basically those knots that you feel in those muscles. You know, they get those big old lumps that happen. Those lumps are basically the waste product of the muscle, and the waste product is a little bit toxic, a little bit inflammatory. And so the problem is because that muscle doesn't work right, that doesn't get out and get filtered out, okay? And so because it's dysfunctional, it stays there. But the body doesn't like it, so it walls it off, and it creates a point called a trigger point. And it triggers pain, because I can sit there and I can mash on it, and you'll be like, oh, that hurts, keep doing that, because it feels better as it starts to dissipate. And the problem is that when you're doing it from the outside, massage therapy and those kind of things can help, but it'll all start to come back if we can actually use the needle to penetrate that and break that up. It gets out of there much faster and has a lot less tendency to come back. Used in the trigger point, in the actual solution that's in there, is called lidocaine. Lidocaine is an anesthetic. That is it. It is the needling really that helps. The lidocaine gives some anesthetic properties to it to make it feel a little bit better. The other is large joint injections. That could be your shoulders, your knees, your SI joints. When you have pain and inflammation going on in those areas, then our nurse practitioner can come in and give an injection into the joint, which is usually guided through what's called a diagnostic ultrasound. So the ultrasound guides her in terms of where she goes. Again, you don't feel anything but the mosquito bite. Both these processes are about 5 minutes long at most. And with the large joint injection, she's going to inject lidocaine, and that mixed with what's called Toradol or ketorolac. That is a non-steroidal anti-inflammatory. So we do not use steroids in either one of these types of injections because, you know, you can look at the literature, and steroids, they will bring down the inflammation, but the only problem is that the steroid will actually eat away the tissue. Is that helping the person gain back function? Don't think so. So we stay away from that as much as possible, okay? So those two things are super to help people move faster, because here we've incorporated the chiropractic care and the physical therapy also. And so if you're trying to move and exercise on muscles that have these trigger points in them and joints that are inflamed, how well do you think that goes? Not as well if that inflammation wasn't there. So if we can get that out quicker, that's an awesome thing. So that's one of the helps that we can do here to get you moving faster. You know, a traditional chiropractic care plan for, you know, on average, I'd say is probably anywhere between 8 and 12 months. With what we can do here and the different aspects of the care that we can deliver, that traditional chiropractic care plan moves to 4 to 5 months. And that's what we see generally across the board. So, you know, keep working on the root cause. Yes, we want to help out with the symptom that's going on, but work on that root cause of your pain and inflammation. Dr. Todd Molsky.